dentistry project was introduced following some work that I did whilst seconded into the community with the dementia pathway team, and coming into role as caremaker back onto the inpatient wards where I'm now working. I wanted to see if I could transfer that work over. So I looked at bringing the dental team onto the wards from there. Historically, we weren't offering a lot of support around people's oral hygiene, that kind of thing. And I've made connections with the community dental team who were offering a quarterly in-reach onto our older adult ward. And I wanted to look at how we could expand that and implement it on the working age wards as well. I think we needed to offer a more holistic service to our patients, thinking about their physical health as well as their mental health, which is where I looked at bringing the dental team onto the wards to see if we could create some impact with that.
My name's Laura Brooks. I was ward manager for Dale Ward at Penn Hospital here at Black Country Partnership Foundation Trust. I supported Tony with the implementation of the dentistry project by making sure that he knew where to take things to. So when he came to me with the idea, I thought it was a great idea, really met the clinical need of our patients and filled a gap most definitely.
Before we introduced the dentistry project, we would have patients that may be struggling with tooth pain, and we would then refer them to the dental team that we're now working with, but we would transport them down to their office, which is over the other side of the city. So that would incur staff taking time away from the wards to escort them down there.
Patients think that this project has been a really good idea. We've had a lot of positive feedback about it. A lot of them were either fearful of the dentist or were fearful of travelling to a dentist, not wanting to go there on their own but not having someone to go with them. So by bringing the service here, we've really been able to support people to get that initial treatment and to get that initial contact that can then be followed up. A lot of patients on the ward were quite surprised, I think, that we were offering them this service that they haven't been offered before, but have been really appreciative of it. The project has really good outcomes for people in terms of better experience, because they have an experience where they're getting like I say, a whole person approach to their care. So we're not just focusing on their mental health, we're looking at all other aspects of it, including dentistry. So having a service for that group of hard to reach patients has just had wonderful outcomes for them.
I led the change as I started working with the team before I came back to the wards in 2014. I've arranged meetings with everybody that's involved with implementing the change and implementing the project on the hospital, from senior management to housekeeping staff.
This project has really been taken up by colleagues in senior positions. They think that it's obviously great for patients, the cost effectiveness and the partnership working with people from another organisation has been great as well. And just to offer our own staff that sense that they are important and that they can lead on change has seen a boost in morale of people that have seen Tony do this, and other people are coming forward with ideas as well. So it's only benefiting the trust and patients.
I still don't see myself as a leader. I do what I do. I'm very passionate about mental health. I've got a long history of supporting people on the hospital and away from the hospital, and I care very deeply about the service that we offer. I would advise people to get out and start having conversations with everybody around you about what your idea is. Find a team of people that are passionate about those same things, and then look at what you need to do and get on and do it.
To any other colleague that's got a member of staff that's got an idea about how to change practice or service, I would say get behind them 100%, because everybody within your organisation can be a leader and can lead on a change.